Which cephalosporin is the drug of choice for bacterial meningitis caused by Neisseria meningitidis? Ceftriaxone. First-line drug for prophylaxis of rheumatic fever in penicillin-allergic patients, erythromycin. Which antimicrobial inhibits transpeptidase, PBP, by forming the covalent D-ALA mimic? Penicillin G. Glycopeptide reserved for MRSA bloodstream infections, vancomycin. Redman syndrome is an infusion-related reaction to which antibiotic? Vancomycin. Carbapenem highly resistant to most beta-lactamases and combined with cilastatin to prevent renal metabolism, imipenem. Monobactam useful against gram-negative aerobes in penicillin-allergic patients, estrionam. Doc for Listeria monocytogenes meningitis in neonates, ampicillin. Beta-lactamase inhibitor paired with piperacillin, tazobactam. Time-dependent killers. Give one example antibiotic class. Beta-lactams, example, penicillins. Concentration-dependent post-antibiotic effect is best seen with which class? Aminoglycosides. Aminoglycoside causing vestibular, auditory ototoxicity, streptomycin. Preferred agent for plague, Yersinia pestis, streptomycin. Macrolide with longest half-life, suitable for single daily dosing in CAP? Azithromycin. 50S ribosomal inhibitor used orally for MRSA skin infection. Risk of CPK elevation. Linezolid. Important adverse effect common to chloramphenicol and linezolid with prolonged therapy. Bone marrow suppression. Which tetracycline is safe in renal failure because it is excreted via bile? Doxycycline. Drug of choice for scrub typhus, Orientia tsutsugamushi, doxycycline. Give one absolute contraindication for tetracycline use. Children, 8 years, tooth discoloration. First-line combination for H. pylori eradication includes PPI, clarithromycin, and which other antibiotic? Amoxicillin or metronidazole. Metronidazole's mechanism involves generation of all radicals that damage DNA, free nitroso radicals. Alcohol disulfiram-like reaction is notorious with which antiprotozoal antibacterial? Metronidazole. Prosody rate 30. Drug causing tendon rupture, boxed warning. Fluoroquinolones, e.g. ciprofloxacin. Fluoroquinolone preferred in MDR-TB as a second-line agent. Levofloxacin or moxifloxacin. Name the DNA gyrase subunit inhibited by quinolones, gyrase, and topoisomerase 4. Trimethoprim inhibits which enzyme in folate pathway? Dihydrofolate reductase. Totramoxazole is the DOC for prophylaxis of which opportunistic infection in HIV? Pneumocystis jirovecii, PCP. Give one potassium-sparing diuretic that potentiates hyperkalemia risk with cotrimoxazole, spironolactone. Doc for severe falciparum malaria, parenteral, partesinate. Only antimalarial active on hypnozurites, liver dormant forms, primaquine. G6PD deficiency patients risk hemolysis with which antimalarial mentioned above? Primaquine. Drug of choice for visceral leishmaniasis in India after resistance to antimonials? Liposomal amphotericin B. Azole that crosses BBB and is used for cryptococcal meningitis step-down therapy, fluconazole. Amphotericin B's dose-limiting toxicity, nephrotoxicity. Echinocandin effective for Candida glabrata biofilm infections, caspofungin. DOC for Enterobius vermicularis, pinworm, albendazole, single dose. Which antihelminthic causes microfilary paralysis via Cl-channel opening? Ivermectin. Praziquantel acts by increasing permeability to which ion in trematodes? Calcium. First-line 4-drug regimen for drug-susceptible pulmonary TB includes INH. Someone, rifampicin pyrazinamide, ethambutol. Isoniazid inhibits synthesis of acid in mycobacterial cell wall, mycolic. Fast acetylators of INH are prone to which toxicity? Hepatitis or neuropathy? Hepatitis. Peripheral neuropathy due to INH is prevented with 10 mg per day of which vitamin? Pyridoxine, B6. Color of urine with rifampicin therapy, orange-red. Ethambutol's hallmark adverse effect on vision. Optic neuritis, red-green color blindness. Pyrazinamide is active in which milieu? Acidic basic inside macrophages, acidic. Second line, anti-TB causing irreversible ototoxicity similar to gentamicin, amikacin, or kanamycin. Name one diaryl quinoline used in MDR-TB regimens, bedaquiline. Bedaquiline targets which enzyme of M. tuberculosis? ATP synthase. Which antiviral is a neuraminidase inhibitor effective against both influenza A and B? Oseltamivir. Ganciclovir is first line for which CMV manifestation in AIDS? CMV retinitis. Prosody rate, 130%. Dose-limiting toxicity of ganciclovir. Break time 400 milliseconds. Myelosuppression. Antiretroviral class causing vivid dreams and neuropsychiatric effects. Give one drug. Efavirenz, NNRTI. Integrase inhibitor recommended in first-line ART triple therapy. Dolutegravir. Protease inhibitors end with which three letters? Navir. Boosting agent used with lopinavir to increase plasma levels? Ritonavir. Amantadine acts on which viral protein to block uncoating of influenza A? M2 ion channel. Doc for genital herpes, HSV2 primary infection, acyclovir. Valacyclovir becomes active after conversion to acyclovir via which process? First-pass hepatic hydrolysis. Which antifungal is effective against Pneumocystis jirovecii but is not a typical azole? Pentamidine. Doc for severe C. difficile colitis unresponsive to metronidazole, vancomycin oral. Give one antibiotic that causes gray baby syndrome, chloramphenicol. Mechanism behind chloramphenicol-induced aplastic anemia, irreversible marrow mitochondrial toxicity. Drug of choice for DOC for Lyme disease in non-pregnant adults, doxycycline. Alternative to doxycycline for Lyme disease in pregnant women, amoxicillin. Doc for treatment of syphilis at any stage, except neurosyphilis alternative, benzathine penicillin G. Jarisch-Herxheimer reaction occurs after therapy for which spirochetal disease? Syphilis. Give one antibiotic that covers MRSA and causes daptomycin lung surfactant inactivation. Daptomycin can't be used in pneumonia. Tigecycline belongs to which class of tetracycline derivatives? Glycylcyclines. Which antibiotic combination is used for gut anaerobes plus gram-negative coverage in intra-abdominal sepsis? Piperacillin tazobactam. Doc for nocardiosis, cotrimoxazole. Doc for MRSA pneumonia when vancomycin MIC creep is observed, greater than 1.5 micrograms. Linezolid. Gray baby syndrome is due to deficient conjugation in neonates. Glucuronidation. Give one antibiotic contraindicated with statins due to rhabdomyolysis risk. Clarithromycin. Name the enzyme rifampicin induces that reduces efficacy of oral contraceptive pills. Cytochrome P450 3A4. Antibiotic causing cartilage damage and thus CI in children less than 18 years. Fluoroquinolones. Doc for anaerobic pelvic inflammatory disease PID, along with ceftriaxone. Metronidazole. What is the post-exposure prophylaxis PEP window for oseltamivir after flu contact? Within 48 hours. Which topical antibiotic is first line for impetigo due to Staph aureus? Mepiricin. Give one drug causing red-green color blindness as toxicity, ethambutol. Preferred oral therapy for VRE, Enterococcus faecium infections, linezolid. Which antitubercular causes gynecomastia due to endocrine effects? Isoniazid, via altered steroid metabolism. Cefepime belongs to which generation of cephalosporins? Fourth. Which antibiotic class disrupts peptidoglycan by binding D-ala before cross-linking, not PBP? Glycopeptides. Doc for gonorrhea, as per 2024 NACO guideline. Ceftriaxone 1 gram IM single dose. Give one drug used in MDR-TB that prolongs QT interval significantly. Bedaquiline. NOA of phosphomycin involves inhibition of transferase in peptidoglycan synthesis. MER-A, enolpyruval. Nitrofurantoin is contraindicated at which creatinine clearance? And then 40 milliliters per minute. Give one drug of choice for C. difficile if both vancomycin and metronidazole fail. Fidaxomicin. Combination in cotrimoxazole works via sequential blockade, plus enzymes. Sulfonamide DHPS, plus trimethoprim, DHFR. Which HSV antiviral requires phosphorylation by viral thymidine kinase for activation? Acyclovir. Anti-influenza drug that blocks cap-dependent endonuclease, baloxavir, marboxil. Name a lipid formulation that reduces nephrotoxicity of amphotericin B, liposomal amphotericin B. Which antifungal inhibits 14-alpha-demethylase in ergosterol synthesis? Azoles, e.g. ketoconazole. Azole with endocrine side effects like gynecomastia? Ketoconazole. Which imidazole is preferred for tinea corporis once daily for 2 weeks? Clotrimazole topical. DOC for acute invasive aspergillosis? Voriconazole. Which antimalarial is recommended in pregnancy for chloroquine-resistant P. falciparum? Artemisinin-based combination therapy, artesunate plus clindamycin. DOC for strongyloidiasis, ivermectin. One long-acting tetracycline analog effective against MRSA and atypicals in CAP4 therapy, tigecycline.